So Jean-Paul, it's a pleasure to speak with you again. Certainly I've been tracking you for a while, Resolution Project, and of course your group, your nonprofit, Unspoken Smiles.
Correct.
Tell us a little bit about Unspoken Smiles.
Absolutely. So thanks for having me, Jeff. I know we've been following each other for years now, and you've seen the progress from the very beginning, which indeed started with the Resolution Project because they were the very first organization who believed in me and invested in me with seed funding and other resources to help me get this off the ground. But it initially started after the earthquake in Haiti, where everyone's were focusing on food, clothing, and other issues. But when I see the opportunity while I was studying dentistry at NYU College of Dentistry, so to bring that attention towards this issue, and I traveled to Haiti. And then the children that I saw there, like the event behind the destruction, the death, and all this tragedy, the kids were still smiling. And that's what gave me it was the duality of this moment that gave Unspoken Smile its name, because I knew there was a story to be told behind each of those smiles.
Well, I think the great Haitian smile, as you say, is also why we always say Haiti mon cœur, right? Well, talk about specifically what you do with your organization and how it serves kids and beyond, even adults, I've seen.
Absolutely, yes. So to understand the work that we do, you have to understand the issue. So oral health, or oral disease rather, is one of the most overlooked health problems in the world. 3.58 billion people are affected by oral disease. And among that number, 3.48 billion children do not have access to care. So now we don't know exactly what's causing the issue, whether it's access to care, whether it's awareness, people are not aware that they should go to the dentist, or simply it's because people don't have money to pay the cost of healthcare. So there's many social determinants causing people from seeking care, and the availability of dental services versus providers and communities. So what we want to do is not solving this issue as a treatment like many organizations who work in the space are doing, because you can treat an affected tooth today, 3 months later that same tooth can develop another infection. So treatment doesn't really solve the problem. So what we do, we tackle the root cause of the issue to three main programs. The first is a school-based program where we partner with a local school, so that to ensure that kids constantly learn about the importance of oral health, but give them the power and the resources to take ownership of their own teeth. So as a 12-week programs throughout the semester, kids will learn about oral health, and then at the end of the 12 week, they get to present to a panel of judges, students, members of the community about what they learned. So that way, that instills in them the knowledge. Once they see something is wrong with the teeth, they have to seek care. And the second aspect of a program, we realized that as we're doing the pilot programs around the world, we realized that education alone wouldn't solve the problem, because people still didn't have access to care. So here in this country, twice a year you get a call from your dentist to say you have to come here. But in many locations around the world, they don't have that luxury. So what we did, we designed a fellowship program to train local women as community oral care professionals, so that way they learn the basic skills to provide basic cleanings within their own communities. Also earn some money that could help them get out of poverty. So it's about women empowerment, and at the same time help bridge the huge gap between dentists and the population, which will ultimately bring people closer to the dentist and dentists closer to the population.
Well, I've seen a lot of your videos from the trips you've taken. Tell us about the different places that you've gone well beyond Haiti.
Yes, absolutely. So the project started in Haiti, and then we had people from different countries who wanted to get involved. So then I realized, whoa, this is not just a Haiti problem, it's a global problem. So we might as well take the opportunity to tackle this for once and for all. So we designed a country representative program where young leaders would apply to present the idea of solving the whole health crisis, so that it's not just me trying to do something, but it also delegate tasks and opportunities for other young people who may not have a voice but have the talent and skill to really contribute to the big issue. So to date we have 8 countries representative in India, Romania, El Salvador, Guatemala, Haiti, Dominican Republic, and most importantly, Kurdistan, Iraq, which is one of the most active groups we have, and they have the largest group of people. And I think the work that we do in those communities are like really empowering them to take action in a way that we've never seen them before.
I know you're very involved in the UN because we've met many times at General Assembly meetings and at various other conferences throughout the year. How has that partnership developed, and how has it supported you and you them?
Yeah, absolutely. I think from a branding perspective, it really put us on a different level, because within the first 2 years of the organization's existence, we were able to secure a partnership with the United Nations, ECOSOC, and Department of Global Communication, which used to be the DPI. So which is one of the greatest accomplishments for us today, because for what it represents in the UN, but more importantly, as the first oral care organization to be affiliated with the UN, it represents something really big. So that way, people are ready to listen to us, you know. And when you look at the SDG, the Sustainable Development Goals, there are 17 goals. One of our goals is goal number 3, which has to do with good health and well-being. So if you look at the targets with the goal number 3, there's nowhere in it that mentions oral care. There's nowhere. So we are going to be the first organization to bring attention to that issue and make sure that it included inside the goal number 3. So, yeah.
Well, I have to also say that you do so much work overseas, right? But having gone to school here, you know very well that even in a country like America, let alone New York, a very rich city, so many people neglect their teeth. There's so much negligence in terms of getting regular and having affordable access to dental care for most folks even here back home.
Absolutely. And so I, aside from my background as a dental hygienist, I also have a master's in public administration from Columbia University. So I understand firsthand the policy issues and the oral care issue when it comes to access to care. So now we are here in Midtown, one of the richest zip code in the country. And if you go a couple miles north to Harlem and the Bronx, the level of people or the number of people who do not have access to or who are suffering from oral disease, it's a huge number. And it's not just adults, it's also children. So that's why we also decided to launch a program in New York City. So in fact, our first partnership with Amber Charter School in Brooklyn will be launching next week. So that will allow us to tap into the U.S. school system. So that way we bring access to care for the children who don't have underserved communities in the U.S. as well.
Now, I'm of a generation, having grown up in New York as a native New Yorker, where we actually in the public school system used to have a public school dentist on site that would come in. And I don't know, I can't judge the care. It might be where I got my fear of dentists. But we had it, and as far as I know, there was no charge. It was part of services provided as a student.
That's right, you are right. So I think New York City health system, they have a program that bring dentists to the school system, but the issue is the quality of care is not the same as if you were to see a dentist. So it's access, quality, and cost that's causing most of the issue. But our program is focusing more on behavior change, which is that, yes, we will get you care, but also you have to understand your mouth. You know, it's part of the body. Your teeth are the only exposed bone in your entire body, and we want those kids to take ownership of that and to understand when something's go wrong. And even if the school system is not available on a regular basis, they can find care through our program, and we help them do that. And I think it's an important difference to make when it comes to treatments versus awareness of the issue. So, which is what we're mostly focusing on.
Well, I have to say, anybody that does have that fear of a dentist has not met you, Jean-Paul, because the joy of the kids that you work with, I've seen it in the films, and the way you approach them and get to them, and get them really doing good oral hygiene and being aware of that is really commendable. So I thank you. I thank you for the work you're doing, and also for dropping by to share it with us here at the FBA.
Thank you so much. It was an honor to work with you.